I'm really so pleased to be welcoming Professor Jennie Hudson as our next presenter this morning. Professor Jennie Hudson's just recently joined us, or has it recently? Feels recently, but she's our Director of Research and has come across from Macquarie University, and we're so thrilled to have her. But I'm going to read her bio properly here because I want to do it justice. So Professor Jennie Hudson is a Fellow of the Academy of Social Sciences of Australia and has made a distinguished contributions to understanding the factors that contribute to young people's mental health. And we're really talking about young people here. She has worked to improve the services available to young people experiencing anxiety and depression through the development and validation of innovative, accessible interventions. Before she came to Black Dog, Jennie was the Director of the Centre of Emotional Health at Macquarie University and was awarded the ARC Future Fellowship and a Visiting Fellowship at the University of Oxford. Now, ladies and gentlemen, Jennie's going to be talking to us about improving access to evidence-based mental health care for children and their families. If you are like me and you've got a young child, this is the session where you want to ask that question. We had Jennie join us on a panel a few months ago now at our last live event, and there was not a sound in the room as she was talking about kids. So if you've got a question that is relating to either you or a child that you're looking after or a friend, then this is the time to ask it. There are no such thing as silly questions on the back of this. So without further ado, Jennie, I'm going to throw over to you and welcome. Thanks very much.
Right. Thank you so much, Taz. So there has been this increase in anxiety and depression in children and young people, and it's become this really major national issue that's facing us, and it's of national significance. And I really thank you for the opportunity to talk to you today about the work that we're doing at BDI. You've already heard a little bit about it, but I want to focus particularly on this age group of children and young people, more so the primary school age, early high school. You'll be hearing from others later in the day around the kind of end of the high school range. I'm really focusing on the kind of primary school age and early high school. But I wanted to tell you a little bit about my why first, about why I do this research and what drives me. Are these two gorgeous critters, my daughters. I have two young girls that my partner and I are raising through this chaotic time. This photo looks nice and rosy and cheery, but sometimes it's really tough raising them. Not all the time, but particularly at the moment in lockdown. I don't know if other parents on the line are experiencing the same thing, but it can be really tough being a parent. But I have a PhD in child clinical psychology, and I'm an expert in youth mental health. I have a supportive partner and a good job. But even with this knowledge and these resources behind me, I find it really tough being a parent. So, my goal really is to want to raise two emotionally healthy children. With COVID, it is a real challenge, and we've seen an increase in anxiety and depression in Australian children and teenagers. And Australia's system really needs a major overhaul. It's hard for families to know where to find the right care, when's the right time. It's also really hard navigating the mental health system, and as Sam referred to as well, the waiting lists at the moment are really long. And there's no adequate evidence-based programs to prevent anxiety and depression in young people. So this is my why. This is what motivates me. I want to help families find the right care at the right time and raise emotionally healthy young people. So as I mentioned before, we've seen an increase in anxiety and depression in children and young people. Results from a recent study from our team actually showed that 1 in 5 children and teens are experiencing high levels of anxiety and depression. This has increased since COVID, obviously, but there was also an increase prior to that I think is really important to acknowledge, that these issues were increasing already before COVID hit, and COVID has really exacerbated this. And as I mentioned, I'm particularly interested in the under 14-year-olds. And if we think about this from a population level, this equates to over 600,000 children in Australia experiencing high levels of distress. And if we look at the extreme end of that, those young people who might actually meet criteria for a diagnosis of anxiety, an anxiety disorder or depression, this is about 250,000 children with anxiety and depressive diagnosis. So we need a better solution than the one we currently have. Now, this chart shows the rough percentage of young people with anxiety and depression who do seek help, so around 60%. So there's still quite a number of people who don't seek help. And of those people who do seek help, there's a really large percentage who don't actually receive what we refer to as evidence-based care. This data came from a study we conducted last year showing that children and young people could only recall, or very few percentage of them could actually recall receiving what we would refer to as evidence-based care. When we look further into those young people that do receive evidence-based care, a little over half of them that treatment is successful, which is great, but we've got a lot of work to do into improving those treatments. So we have treatments that work, but there's a lot of work that we can do if we invest in this to actually increase that success rate. All right, so this is important because if we don't get it right, we know that young person who experiences anxiety and depression, if this is untreated, they have actually an increased risk throughout their life. It's not just in childhood or adolescence that this is a problem, that it increases their risk across the lifespan, and also increases their risk for other mental health problems and substance use problems as well. And we know that anxiety in particular is a increased risk for suicide. We know the risk of depression, and that's often talked about, but having anxiety increases a young person's risk for suicide. So if we want to tackle the national suicide rates, then targeting anxiety in children, particularly in this primary school age, is really critical. It's also important to, we think about, it's often hard to know, anxiety is really normal, sadness and low mood is really normal in teenage years as well. But it really does, when it gets to this extreme level, it does have a significant impact on the young person's life. So, there are increased days missed of school. So we know young people will miss about 3 weeks of school just because of anxiety. It impacts on their friendships and has quite a significant impact on their development. I thought I'd also talk, before I talk about our solution, I wanted to, if there were some parents out there, just talk about a few tips for those parents, given that I'm struggling. I thought I would pass on some information that I think might be useful for parents, the things that we know might improve young people's mental health, particularly during COVID. And one of the first things is just being focused on healthy habits. Even though, we know these strategies work, but actually implementing them can be challenging, but really important. So healthy habits like sleep, particularly in adolescence, sleep is really critical and sets up the rest of the day if they don't get a good night's sleep. So really important to make sure that your young person is getting adequate sleep and not potentially using screens into the evening. Other healthy habits like healthy eating and regular exercise are really important healthy habits to get into and not lose sight of during COVID and not let those things slide. Importantly, taking breaks for self-care as well. These are really critical if you, as a parent, to be able to be supportive to your young person, making sure you're looking after yourself as well. Making sure you've got time to listen to your young person as well, creating opportunities to talk to them and listen so they know that you're being heard, that they're being heard. Also scheduling fun things in the week as well. I've been working on this myself, trying to make sure I've got fun things to look forward to. Staying connected is really important for young people. It's a critical time for them to develop friendships and develop their identity. And when they're not connected to other people during COVID, this is particularly important. So looking for ways to keep them connected. And if these things are not working for you, then seeking help and having some resilience around that at the moment. The waiting lists are long, and we are, as I'll talk to you about, we are working on some solutions for that as well. But seeking help when you think it's better not to wait. If you're unsure, seeking help is really important. All right, so I want to talk about our solution, what we're doing at BDI. We've come up with a plan for how we want to move forward and how we want to tackle this increasing problem in youth mental health. So first of all, because there's a significant number of people that are not seeking help, we want to move to this blended care approach that Sam was talking about before. At the moment, we don't have an online clinic for children and young people. So this is one of our key priorities, is wanting to develop an online clinic for children and young people that is a hub for parents and young people and that delivers telehealth solutions, provides different options for young people. So that will be one of our first priorities. Also, we know that teachers are often the first port of call for young people, and they don't receive any training in mental health. So we are developing some training program for teachers, particularly around anxiety, to help them understand that. One of the big projects we want to be working on is also developing a new mental health curriculum that focuses on prevention. And we know that by delivering universal, meaning that everybody receives access to prevention programs, we can have an impact on reducing mental health. So integrating that into curriculum around Australia. The next step is we want to make sure that clinicians, practitioners are delivering evidence-based care. And so to supplement that hub that we talked about before, that blended care model, we want to develop apps that really help parents and young people target anxiety in particular, that perhaps focus on the key ingredients of treatment that we know work. We also, a lot of the programs that are available for mental health actually require a lot of reading, but we know mental health problems and reading difficulties often go hand in hand. So we are working on a program specifically for children with reading difficulties and mental health problems as well. And our third, and perhaps one of the primary focuses, is using a stepped care model in primary schools. So this has been tested, and you'll hear about this later today, in high schools. So wanting to use this model of a stepped care is that idea that everybody receives some level of intervention with our universal prevention that we talked about. And then those young people who have higher symptoms, have higher levels of anxiety and depression, we provide more targeted care. So it's delivered in a stepped care way. And this is important because schools are such a universal touch point, or near universal, I should say, and how can we deliver these mental health, evidence-based mental health interventions in schools? And finally, we want to improve our outcomes. So the moment we're getting between 50 to 60% of children and young people who no longer have any anxiety and depression at the end of treatment, we want to improve that to be more like 80%. So we want to work on optimising our treatments. We're also collecting data from around the world in clinics around the world that deliver this kind of intervention, and pooling our data together so that we can develop a new clinical decision-making tool that will help clinicians personalised treatment more. And we think that is a really good option that's worked really well in other areas of healthcare, and we want to work on that in mental health care as well. Our goal through all of this, I've talked about a lot of different research programs that we're focusing on, but we really want to be able to help every Australian child who struggles with anxiety and depression. That's our goal. We wanted to be developing these new evidence-based treatments, and that's what we're going to be focusing on next year, is co-designing all of these tools and then evaluating them in the coming years as well. So thank you very much.
And the as exhibited by the comment and question box, which is really lightening up. There's one sort of clear, or there's a couple of clear themes that are coming here through on the questions, but the one clear one is around evidence base. And Marcus has put a good question here, which I wouldn't mind putting to you, Jenny, which is what's the criteria for evidence-based care, please? How much evidence is enough for it to be useful? Can you just give us a bit of an indication of the steps that we go through to understand that it's evidence-based care?
Yeah, it's a really good question, because I think that term gets bandied about quite a bit, and we don't really use it the way that it should be. Evidence-based, the process of developing a treatment that works, as there is a clear process. You first of all pilot it and see that it works and that it's user-friendly. The next step is that you then test it, just whether or not we get changes pre and post the delivery of the intervention. But most of the time, because of expectancy effects, we do get change before and after a program is delivered. So to test it, you want to work to see whether it works against doing nothing or a wait list. That's the next step. So does it work compared to doing nothing? Then the next step is being able to test whether or not it works against other active treatments. So doing other things, there might be receiving information or counselling where there's no strategies. So the process is quite rigorous, and that's really important that we don't, and this is happening quite a lot around Australia, is that programs are being delivered that actually don't have evidence that they work, particularly in schools. There's a lot of programs that say they're evidence-based, but actually they're not, and they've never been tested. And it's really important for us at Black Dog is that we deliver interventions that that have been tested, and we have a real process for that within Black Dog to make sure that before something is delivered, we are confident that it is going to work, and not just better than doing nothing. So that's a really important process. And in terms of when I referred to as evidence-based care before, there's guidelines around what should be delivered based on the evidence. Usually a group of clinicians or a board get together and decide, okay, based on all of the evidence that we have, we do systematic reviews of all of the literature, and then we make a decision, what has the most evidence to actually be delivered. And so there are guidelines about what that treatment should be. Hopefully that makes sense.
That does. Thank you, Jenny. And I make the joke, you can't make a cup of coffee around Black Dog Institute without being evidence-based. It's certainly, absolutely core to what we do here. There's another good question here from Ben, which is really goes to the heart of what most families are experiencing at the moment in lockdown, certainly on the East Coast. We're talking about looking after your kids during this period, and the question really is, what specifically is being done to bring this into school? Different question. Thank you, Ben. That was a very good question. Question above. Sorry. It's very difficult in a scenario when lockdown impacts on kids' ability to have physical connections, which is a good point. What would you suggest here? And I know, look, from my daughter who's 11 out the back, who's watching this at the moment, getting her active and getting her out as part of a day when she's at school on screen, and then really her only social connectivity after the day is on screen as well. Any suggestions for how we can get our kids out and about looking after their mental health?
Yeah, I think there has been a lot of negativity around screens, but it's not actually, it's what you do on the screen that's important. And so using screens to connect with young people, connect young people with their friends, I think is really important. And I think there is some anxiety for parents, I don't want you using that technology. But it is really critical. If that's the only way that young people can stay connected, using screens to do that, I don't think is a bad thing. There are other potentially not healthy things that might happen if a young person is using screens all the time and they're not sleeping properly, then they're using screens instead of being physically active. So it's kind of getting that balance right. But I'm not thinking as screens necessarily as evil and something that shouldn't be used, but it is really important for young people to be connected with their friends, and that often means connecting, particularly at the moment, connecting via screens. So it's just trying to get that balance right. And also a lot of agency has been taken away from young people. What I mean by that is their kind of sense of control, and they're shaping their own lives. And that is something that, because of lockdown and there's so many rules, this is the time when young people often exploring their worlds and being more independent, but yet we've taken that away. So thinking about other ways that you can bring in control into their life and making choices about what they'd like to do. So making choices about who they'd like to connect with, or how they'd like to exercise, or what meals they'd like to participate in. So just kind of trying to bring that back into a young person's life as well.
Thanks, Jenny. And I think that's so true. And can I just ask just a bit of a follow-up question to that? As a parent, you're obviously, I'm always really, looking out for those warning signs, for those triggers that might be possibly happening with your young ones. Are there any that as parents we should be looking out for, especially during these lockdown times?
Yeah, great question, Taz. So if they are withdrawing and not wanting to interact, so if they're staying in their bedrooms all the time, not just because they're interacting with their friends, but if they're doing lots of focusing on social media where they're not connecting with their friends and they're just withdrawn, that's a really key sign. Irritability is also a really key one, and we get lots of changes with that with teenagers anyway, and primary school age children as well, but just watching for that. So irritability can be a sign of low mood if it's there all the time, and also that kind of fluctuation, that unpredictability is a key warning sign. If you're seeing changes in their eating habits as well, they're concerned about their body image. Also, lots of reassurance-seeking questions is a key sign for anxiety. If kids are asking you lots of questions, and that if you feel like you can't, when you answer them, that still doesn't resolve it for them, that they're still asking lots of questions, that's another key sign that they're worrying. If their sleep's been affected, it's another warning sign as well. So we're looking out for their sleep, their eating, their mood, their kind of what they're asking you about, that reassurance seeking as well.
Thanks, Jenny. There are such sage words, especially for parents at the moment. We've got about 3 and a bit minutes left, and there's a bit of a theme here going with the questions, which I'd like to just touch on, which is schools and schools' role in helping us to deliver evidence-based care. And Ben's got a good question here, which is what specifically has been done to bring this into the school curriculum, and who will be qualified to present this important information?
Yeah, at the moment we don't have a clear process for that, and we are speaking with government about this issue and some recommendations around having better guidelines for what is delivered. We have guidelines around the curriculum, but in terms of what is delivered within that, there are no regulations around that at the moment. And so lots of different programs are being delivered and there's not consistency around that. But we do have evidence that there are some programs that do prevent anxiety and depression. So our goal at Black Dog is to be able to implement these interventions, the ones that are evidence-based, in schools. At the moment, there's a lot of choice that schools have around that, and we think that's a little bit problematic because there are lots of programs available and lots of people that don't necessarily have the training or don't understand evidence-based care that are developing these programs that aren't evidence-based, and they're being rolled out. And we actually don't know whether they're going to improve mental health. And one of them actually is one of them that's been used quite a lot is mindfulness techniques, which works really well in adults, but we actually don't have any solid evidence that it works effectively with young people. And in fact, evidence that it's unlikely to deliver changes, but yet it's being implemented in schools quite regularly. So we are working with, this is a big passion for us, to try and shift this and to try and make sure that trained mental health professionals are delivering mental health care rather than people that don't have the training and rather than programs that don't have that evidence base behind them. It's kind of like, if you were having surgery for a heart problem, you'd want the trained surgeon to be doing your heart surgery. You wouldn't want to be having somebody who doesn't have any training in that. And we've got to prioritise mental health in the same way we do physical health, and making sure that we are delivering the best treatment that we can for young people. It is a critical issue, and it's one of national significance that we really need to move on.
Thanks, Jenny. That was truly fantastic. We've got a lot of comments coming there, and just to say that we'll be getting back to your questions if we haven't answered them along the way. Jenny, we've got about 45 seconds left, so you could spend hours talking about this, but it's an important question. Do you see this question from Simone, do you see mental health and wellbeing as partnerships or separate?
Definitely as a partnership. I definitely see that they're both important. Wellbeing is part of mental health in a way, and we often think about mental health in terms of that extreme end, whereas wellbeing is more that kind of global feeling of feeling good and feeling happy, so that they are very much interconnected. And particularly the way Aboriginal and Torres Strait Islander people consider their social and emotional wellbeing, and that's a term that resonates more strongly with Aboriginal and Torres Strait Islander people. But they're very much connected.
Great. Thank you so much, Jenny. That was fantastic to hear from you today. We really appreciate your time. Thank you so much for coming on the Research Showcase.
It's a pleasure. Thanks for having me, Taz.
Yeah, thank you. Fantastic.